Glasgow is Scotland's largest city with a population of around 600,000 people. The city lies on the River Clyde and has a proud industrial past. It grew rapidly during the 18th and 19th century to become one of Europe's main hubs of transatlantic trade with the Americas. At the height of its success, the city was a world-renowned centre of engineering and shipbuilding and was known as the second city of the British Empire. From the 1950s onward, Glasgow entered a long period of relative economic decline, characterised by high unemployment, urban decay, population decline, and poor health for the city's inhabitants. In the last 30 years, Glasgow has undergone significant change. As late as the 1970s, Glasgow was still an industrial and manufacturing city. However, the economic depression of that period destroyed many of these jobs, and since then the socio-economic and employment profile of the city's population has changed significantly. Glasgow is now a predominantly middle-class city, with a strong emphasis on service industries and consumerism. There are many health issues in the city, and stark health and social inequalities exist. There have been many initiatives to regenerate the city over the last 40 years. The most recent being the transfer of ownership and regeneration of the city's social rented housing stock. In 2014, Glasgow will host the Commonwealth Games. How do you feel Glasgow has changed in your lifetime?
I think there's a lot more buzz about the city, there's a lot more, it's a much more welcoming place, I think.
I find Glasgow has actually become quite a cosmopolitan city.
A lot, it's changed a lot. I think they're teaching children to eat more healthily now for a start.
I think the National Health Service has improved greatly, like the smoking ban and stuff like that, and like the healthier eating projects at schools.
People don't care about each other. Years ago, people bothered about each other, and you looked out for the person next to you. Nowadays, they're in too much of a hurry, they're no bothering.
Well, you can obviously see it's quite a prosperous city.
From a health point of view, certainly. There's more public awareness of health issues.
It's changed quite a lot
in comparison to the way it used to look with the old tenements and things. I think the new buildings, the new, especially along the riverside, you know, when you see the
I would agree with you
it's amazing, you know.
I'm a heavy smoker, but I agree with all the doing away with all the smoking in shops, and people don't smoke about kids anymore.
Immensely.
I think we've got a far healthier lifestyle than from the time of our parents, and a lot of that's to do as well with the work that we do. A lot of the manual industries have closed down. I'm thinking of my father and my grandfather and how they worked.
Well, I grew up in the slum area, and I just see improvements in most of the places, you know, fantastic.
It's quite a sociable sort of place, like everyone's, like, I don't know. I like how it's pedestrianised as well.
The buildings and the way people are looked after nowadays.
Busy, lot of new and up and coming things, a lot of development going on.
It's improved considerably. The shopping's got a lot better.
It's quite interesting to see it coming on. It's very busy, it's very dirty.
I think Glasgow's okay. I think it's improved.
And it's enjoying a renaissance.
I would say that through having travelled a wee bit, Glasgow is at least as good as most of the cities I've travelled to.
What have been the major health trends in Glasgow in the last 20 years?
We've seen improvements in life expectancy. We've seen coronary heart disease mortality come down substantially. It's reduced by over a half in the last 30 years.
Regards overall health, it's been quite negative. That's partly, I think, because of the change that took place in Glasgow's economy. I think that had a big impact.
Over the past 20 years, we've seen marked declines in heart disease as well as other chronic diseases. However, with the ageing population, the total number of people with heart disease continues to rise. So although there's less people getting heart attacks, the burden of disease remains high, and I think that's one of the important trends.
At the same time, we've seen inequalities in health persist. So the difference in life expectancy between our most affluent areas and our most deprived areas have continued, and in some areas have even widened.
The appalling health record that Glasgow still got today, but I think it really stems from there, from its industrial past.
What do you think has been getting better and what has been getting worse in terms of health?
The no smoking ban's been fantastic, and I think that'll help.
I've actually noticed that a lot of people are getting very, very heavy.
Drinking, I think, is possibly getting a bit worse.
What springs to mind, a lot of people are more aware of obesity now.
Underage drinking, I know that for a fact, it's been getting worse.
and I think it's a good idea, the cigarettes under the counter, and to do away with the 10 packets.
The young people, they are, I can say they are just running wild. There's too much violence.
An awful lot of prescription doctors, you go in and they're that busy writing that they don't listen to what you're saying, and they give you a prescription to get rid of you, which is wrong.
Too much litter about. They need to clamp down on that.
I think the junk food thing's getting worse in some places because like a lot of people just eat junk food all the time. But I think everyone's more health conscious.
People are too busy to cook properly, whereas years ago people cooked properly, you all sat down around the table, you had dinner, whereas now it's grab something on the go, quick bite, eat and go, processed foods are making these people bigger.
Cars, too many cars.
I think people eat more healthily now, but I think there's still a big problem with binge drinking alcohol.
Well,
the
obesity is getting worse.
Obesity is getting worse,
but you know how they took all the vending machines out of schools and stuff, and they did a lot of healthier eating.
You don't really see more bikes.
More like fast food restaurants and stuff, so
And
that's
there's
not
a lot
so
more
good.
like
when you go shopping and that, they're all over the place.
I think the drinking's getting worse for the youngins.
Lack of discipline. Lack of discipline, Mum says.
I think the school's helping there.
To a lot of the younger people in particular, I think some of them could be doing with getting on their bikes, so to speak, and sort of trimming them down a wee bit.
Fewer people smoking, I think more people are giving up.
People start drinking a lot earlier than we used to, I think.
Well, McDonald's and KFC have came about recently, so that's only really happened in 30 years. This has kind of kicked off, so it's kind of more like America these days. We're getting people like fat people everywhere, basically.
What is different about Glasgow's health challenge than that of other areas?
The major health challenge for us in Glasgow is about the level of disadvantage and deprivation experienced by many of our communities.
The big challenge is the sheer numbers. You're dealing with thousands of people, concentrated, as we now know, in certain pockets in the city.
Glasgow's history is that of a large industrial city. Once upon a time it was said to be the second city of the empire, and its prosperity came from that heavy industry.
I think the difference in Glasgow is not just the extent of deprivation, but the level of deprivation.
It's certain families in certain parts of Glasgow.
Within a decade, that heavy industry disappeared. That happened in the 1970s and 80s. And on the back of that, the poverty of industrialisation has been followed by the social deprivation of deindustrialisation.
Do you think there are different health problems in different communities across Glasgow?
I think people that are deprived and are very short of money and have maybe never worked, they cannot eat as good as somebody that has worked all their days.
It would appear that the sort of less well-off communities suffer more than the better well-off communities still, even 30 years on, yeah.
And that question is, like, you know, depending on what part of the city you live in, I think definitely there's more. I'm not going to mention any like, districts or whatever, but I think deprived areas, you know, there's unemployment, etc.
Issue with the young ones, isn't it?
People, I think, tend to suffer much more because they're scared of the bills that come in through the winter time, so they don't put their heating on, you know.
The poorer areas have much more health.
Well, some places there's more like gangs and drugs and stuff.
I'm not tarring everybody with the same brush or anything, but you know what I mean. It's people on a lower budget who don't have as much money to spend will buy cheaper foods, which may not be as nutritionally good for you as more expensive foods and organic foods.
Like in the sort of poorer areas, there's more like alcohol abuse and stuff.
Yeah, well, poor diets for a start in a lot of areas. People do buy fast foods and not realising the hidden dangers, the saturated fats, etc.
What actions are being taken to improve health and well-being in the city?
There's a whole number of different ways, obviously, that we're trying to improve health. First of all, we want to make our health services as good as we possibly can, so that they do understand the needs of people living in difficult circumstances. They're as accessible as possible to people who are living in areas of disadvantage, and also that we focus and target our resources to where the greatest unmet need is.
Many actions have to be taken to combat these public health problems.
We took a deliberate decision to make sure that the kids coming through the nursery system and the schools were going to be brought up differently.
Which does mean that in our most affluent areas, we are actually reducing the level of support for some families.
Programmes to do with housing, to do with planning, to do with the economy, to do with job creation, to do with education, early years interventions, as well as specific programmes on obvious problems like smoking, alcohol and so on. I think most strategists for health would argue that Glasgow's problems require this multifaceted approach to combat the complex problems that the population faces.
What have you been doing in your own life to improve your health?
Well, I've started going to the gym once a week. I'm trying, and I gave up smoking.
Well, like that, I try and eat a bit healthier. Oh God, I'm not obsessed with eating, honestly. I don't smoke. Try and do a wee bit of exercise now and again.
I try and buy organic products. I do eat a lot of processed foods, which I know aren't great, but when you're in a hurry, try and eat fruit and veg. Try and give her 5 a day.
Swimming, gym. A member of the gym. Yeah, a member of the gym.
We're all members of the gym.
Living in the centre, we both walk to work, so that's a really positive.
It's more of a demand to keep an eye on your body now. It's all over the telly, like Special K, and do this and you look good for summer.
I eat a lot more fruit and veg, seasonal food, and I walk a lot as well.
Yeah.
Don't drive, so I do tend to walk.
I don't really go out my way to run, but I'll run if I'm being chased or something, you know what I mean?
What will be the major threats or health issues in Glasgow in the next 50 years?
Is it that we need to do more of the same, or is it that we need a different strategy? I think we're still trying to understand, and the work that you do in the Glasgow Centre for Population Health is helping us understand that.
One of the most common things we learned about is the amount of people who are actually off work through stress. I mean, some people say it's an easy one for the GP to sign the line and say somebody's got stress. But in a lot of cases you find out it's a lifestyle.
We are now living beyond the carrying capacity of the globe. Britain, if everyone were to live with our lifestyles on the globe, would require 3 planets. In America, that's 4 planets, so-called 4 or 3 planet living.
Inequalities in health will still be a major problem for us. Despite all we've done to improve health and all the progress we've made, as I said at the beginning, we're still seeing inequalities in health.
What things need to change for health in Glasgow to improve?
Well, I think if there's a spiritual revival.
Shut all the pubs and shut all the smoking dens. I started smoking when I was 9 and I stopped it when I was 61 and I don't miss it.
Well, I think they're trying their best just now, don't you, with the smoking and the underage drinking?
Everybody has to change, but it's very hard for people to change. I mean, obviously we can't do it overnight. As I said before, we are aware of the fact that there's lots of health issues out there, but it's really up to the individual to change.
Cannabis, drugs. Yeah. I think there's too much of that, and that's what causes a lot of violence and a lot of unhappiness in homes.
People are living older, living much longer these days, so that brings its own problems.
They're hanging about, they don't know what to do with this, so they turn to vandalism. And a lot of old people stay beside me and, they're throwing stones at their windows. And I think if they did maybe more in that line.
Fast food places being built. And like more sports centres. Yeah, for like swimming pools. Like with better floors and stuff. Like doing more exercise, and like there used to be more exercise in schools because you don't get a lot of PE or anything.
Children need to be educated from a very early age, I think. I think that's where a lot of it stems from.
A lot more gyms, but free access to the gyms because a lot of people in deprived communities can't pay for these.
Fast foods, because they're quick. We drive a lot because it's quick to get to be with cars, so I do think it's just educating people.
People to be educated and like, take care of themselves. Like I think if you just educate people better, then they'll understand that you can't preach.
Well, the streets are dirty, people spit a lot, there seems to be a lot of dog fouling, so they must all be bad for people's health generally.
The number of fast food places is kind of gone a bit crazy.
I think they need to maybe introduce much more things for young people to do. I know in my day you had loads and loads of youth clubs and what have you. There's too many young ones bored out their mind.
Exercise basically is a big one. Obviously you've got a healthy diet, but probably as equally as being active. And certainly from an older generation, parents and grandparents who used cars less, didn't have cars, perhaps used public transport, but certainly walked more. the further back you go, the older people remember walking everywhere rather than getting public transport because they simply didn't have any money for it.
What are the most important things that have been learned about how to improve Glasgow's health?
One of the most important things is an obvious thing, that we have to work in partnership with other agencies. As an NHS, we will never achieve that on our own.
Apart from the things we know on the drug issue, the alcohol issue, I think the biggest threat is if we become complacent again.
So we have to work not just with the traditional partners that we've always worked with, such as social services and education, but with land and environment services to make sure the environment is conducive to physical activity, with Culture and Sport Glasgow so that they have good opportunities for young people to take part in physical activity and sport.
And that there is no single intervention which would transform the health of Glasgow.
Partnership working is very important, and it's not easy.
But to bring in a whole range of other agencies to back us up on this.
The most important thing we've learned is that it all matters.